Hi all, welcome to this video looking at 8-mark questions as part of the Unit 2 and the exam skills. So there's a little bit of discussion on how you might approach, how you might answer some of these questions in the exam. Now just to begin, as a reminder of the exam, it's an 80-mark paper, you get an hour and a half, so it's effectively just over a minute per mark effectively. 8 markers come up frequently throughout the paper. It's a really structured paper with 4 8-mark questions at the end of each section. Each section generally focusing on a different health issue, different need, different ability of individuals in the case study. Across the 3 units that you cover, obviously just again a reminder here of the topics that come up in section A, B and C as part of the Unit 2 content. There isn't that many topic areas to pull materials from, and what we're going to see in a second when I start going through some of the papers and some of the 8 markers that have come up in the past is you'll see the very common themes for those 8-mark questions. So here again for section A, a lot of it's to do with roles, responsibilities of professionals, stuff to do with anti-discriminatory practice, empowerment, health and safety, safeguarding. Section B is more about the structure of the care system, the regulatory bodies, how they're managed, the types of services, the barriers to services available to individuals. And section C is always about age-related needs or specific needs. So care for the young, care for the old, care for those with disabilities. So just to see what is on the exam paper. So for topic A, learning MA, which is all about roles and responsibilities, you can see these are the questions that have come up in the past, or topics of the 8-marker. So you've got a few here about health and social care workers, job roles with midwives, responsibilities, particularly support and routine has come up a couple of times, but you can see there's a couple of areas. Empowering individuals is a very popular topic of 8-mark question. Information management, communication confidentiality, again, very popular topic. Working as part of a multidisciplinary team or working to support a patient with different professionals. Again, very common area that they like to use as part of the question. Safeguarding as well comes up a couple of times, as you can see. In section B, again, looking at settings, the most common area is about access. So things that might affect the access that cause someone to have a barrier to care. And effectively, probably most of those questions tend to come around how you would overcome the barriers. But you can see, particularly that second question, issues affecting service, that June 18, Jan 19, June, it's almost every year these topics seem to have appeared. And then lastly in section C, again, the main topic area is working with someone with a sensory or a physical disability, and often it's about how you provide support, what support put in place, who would take that responsibility. So overall, the popular or common topic areas, things that seem to come up over and over again, which are worth looking at, would be empowerment and empowering a client, confidentiality and communication between a team, particularly keeping confidentiality in place, multidisciplinary teams working together, ensuring safety, responsibilities of professionals and barriers to care. Now, the main tips I have when facing an 8-marker is read the question and the item carefully. Take a minute to plan, think about what you want to say. Is there a theory? Is there something you can build into your discussion? Refer back and link your points to the context or the case study. That's a really important one, making sure everything you say is tied to the person, the context, the situation. If you can, use a theory to tie back, but there aren't that many theories as part of Unit 2. It's more about the practicality of working in care. Be specific in your points. If you make a point or you suggest an idea, again, what's it got to do with the next point? If you say something is unhealthy, say how, why, what. So again, a lot of the questions want you to explain your point, justify it, have a logical reasoning in your answer. And try and evaluate it. If you can highlight a flaw, a problem, some kind of issue which makes it difficult to put something in place, mention it in there. And sometimes you might want to provide a conclusion to show you something up, but again, with 8 markers, not really an essential thing to include. So let's take a look at this 8 marker here. So you can see this question says, discuss the possible advantages of hospice care for Angela and her family. Now these longer questions, they come at the end of each section. You've been writing about Angela, if this was the question or the context, for the first 2, 4 and 6 marker. So now you're just continuing your discussion of her care. Now, because of this, again, 8 marks, about 11 minutes, if you were sort of 10, 11 minutes, there's enough time here that you could write, again, the advantages of hospice care, 2 or 3 advantages of her care. In each case, what is the advantage, why, how, what, who. As an 8 marker, the general rule I have is you make a point, you explain it, do it 4 times, that's 8 marks worth of material that could be put forward. But you might also want to put an evaluation. So this question saying, what are the advantages of Angela going into hospice care? You might want to throw in one potential challenge, problem, criticism, and balance out your argument. The mark scheme and the kind of generally looks like this. So again, there'll be a list of bullet points of things that could apply to the question. What I do like is at the top, it's not an exhaustive list. And if it's anything like the 2, the 4, the 6, it always says accept any other valid response. So as long as what you've said is rational, realistic, logical, you've explained it, it makes sense, then it should be accepted and credited. The 8 markers also use these banding systems, which I will come back to in a minute just to explain how these work. So if we look at this question, and then we'll go through this one together. So you've got a case study about Charlotte, 42, has teenage children and has pancreatic cancer. She's asked for treatment to stop. She's going to a local hospice and she lives at home. And then Susie is the cancer support nurse, from the hospice who comes to visit twice a week and aids Charlotte monitoring her condition. The earlier questions in this series kind of asked about some of the roles Susie has, how she can maintain safety, how she can treat someone or empower Charlotte, how she can support her, what is her responsibility. This last question comes back to safety. It's how Susie can ensure her own personal safety when working with Charlotte. Now the mark scheme says here we've got a list on the left of things that can be included. It's not an exhaustive list. You can see it's got risk assessments, infection control, reporting accidents, first aid. So generally they're very practical solutions, very practical things that Susie could be doing. And then you've got the marking descriptors. And with these descriptors, I wanted to flag up how they're kind of broken up. So you can see the first kind of thing that's pointed out in the levels as you move up from 1 to 3, 4 to 6, 7 to 8, it says demonstrates, or it's demonstrations of knowledge. So isolated knowledge, accurate and thorough knowledge. So basically, the first part of these marks comes from how much information you know, how much you know about this issue. So if you're using technical words, you're talking about conducting risk assessments, you're referring to accident logs, you're talking about policies and procedures like COSH to control substances. Then you show a high level of knowledge. There might still be gaps, there could be some minor omissions, but knowledge and what you know comes across from your writing. The second element is the scenario. You've linked, so it might be you've done a couple links to Susie, there are some links or fairly consistent links, and then there's the comprehensive. So everything comes back to your character, the case study, the context. Tie it to the issue. Always refer to it. That's what's going to help with that connection. And then lastly, again, meaning conveyed but in non-specialist ways. So you've explained or tried to explain, demonstrates logical reasoning, and then obviously evidence is clear. So the way these things are marked is that you have healthcare knowledge, you've applied that healthcare knowledge to the case study, and you've got very logical, detailed, thorough explanations. As a slightly updated mark scheme, just again from the most recent exam paper, you can still see the same categories are there. They've changed the wording ever so slightly, but the same thing applies. Knowledge, is it detailed? Is there connections to the case study? Is there considerations of wider issues? Are you talking about the connection or relationship of issues? So again, same kind of principles apply, but ever so slightly different wording. So let's take a look at an answer. So this first answer here, we can see Susie can ensure her own personal safety when working with Charlotte by following policies, procedures, and regulations put in place. So for me, that would be one thing. If we come back to that question about how Susie can maintain her safety, the student here is identified, she follows policies, procedures. That would be for me 1 mark. And then this includes following the Health and Safety at Work Act, which puts in place laws and guidance on how to remain safe. So for me, There's an example, then a little bit of development, second mark. This is implemented by organisations in different ways. So in the case of health and social care, it includes infection and prevention, infection and protection and prevention. So there's that second point. They've been specific about prevention of illness and control disease. And again, you follow it up. Susie must wash her hands thoroughly, wear the correct clothing, take it off. If she's ill, reduce the risk of illness spreading by not going to work. So again, we've got our point about prevention of infection. We've then got explanation of how to do that. Furthermore, she must follow the safe storage of medicine and substances. This means that she must ensure no harmful substances are left around which could cause harm to her or others. So there we go. We can see we've got follow the policies, health and safety, infection control, wash your hands, substance abuse or protect substances, lock them away. And then lastly, furthermore, there's also policies or procedures in place which provide guidance on how to lift a heavy load. In cases of care, this includes aiding an individual's mobility. Follow these guidelines, reduce risk Susie can injure herself. So that one they've said about heavy loads, but they didn't pick up the second mark here. So the example gave this a 7 out of 8. And really my additional thing, that final bit where it says follow these guidelines to reduce risk, all they needed to do is add in, so this may involve using a harness or lifting equipment. Susie would need to have lift training to prevent or to safely lift a patient. All they needed with that final sentence was just a specific example. And you can see it's 1 + 1, 1 + 1, 1 + 1, 1. And because they're missing that little extra +1 to support what they're saying. If we look at a second response, again, this was handwritten, but we can kind of do the same thing. Susie can ensure her own personal safety, either from other health and social care organisations within the service user allowing this. So basically, the first argument is saying get other people to come in and do the job. This will ensure her safety, as Susie would be protected if Charlotte was to lash out in any way. If Susie was to move Charlotte about, if she were to get really ill, then she would be able to involve outside help from organisations such as occupational therapists. They would be able to install lifts and other medical equipment that would help move Charlotte. This helps keep Susie from hurting herself and others. Now for me, that's where you get some marks here. Lifting equipment and then how it would prevent Susie from injuring herself. They then talk about Charlotte cooking. So Charlotte wasn't able to cook for herself anymore. Susie could discuss meals on wheels, get her eating healthy. So there's a lot of discussion here of things that could be do around the danger. Now, this question got 2 out of 8, and I think the 2 marks come from what we've identified. Lifting Charlotte because it keeps Susie from injuring herself. That's the safety element. There are some potential areas here. So talking about Charlotte lashing out, they could have talked about a risk assessment when working around Charlotte's home, following the lone worker policy, de-escalation of conflict, if Charlotte was to lash out to keep her safe. With the food, they could have brought in food hygiene standards. They could have talked about if Charlotte has a suitable kitchen or safe kitchen to cook in. So there were some potential hints of things that could have been developed, could be extended to push that mark up. But 2 out of 8 for this one here. Now, another question I've got relates to Shirley. Shirley's 45 and has Down syndrome. She's moved out of her family home, and the question all comes down to how social care professionals can support Shirley to live alone. The mark scheme, as always, again, some of the things here: assertiveness, training, transport, money management, life skills, time management, and the marking barriers, the grids, the blocks use the same thing: detailed knowledge, links to issues, and obviously consideration of support. Now, this first response would do the same thing. We'll mark it, go bit by bit, and work out how many marks are allocated. So they say that they could support Shirley by teaching her time management and organisation skills. For me, there's your first one, first thing to do, and that was on the mark scheme. This would help Shirley to be able to get to work on time and have everything she needs on her at the right time. This would ensure that Shirley has some income. So that may be your second point, what it does to help Shirley. They could support Shirley by helping her to get another job. Shirley will be able to have a bigger income. This will allow her to afford to live alone. This would allow Shirley to increase her independence. So there's that second point, our explanation. This could leave, or this could something Shirley to some, they could take Shirley to some classes to teach her how to look after herself and how to look after her home. There we go. This will allow her to gain experience she needs to be able to live without extra support. So again, live independent. They could teach Shirley about how to finance her money. This will allow her to be able to learn how to pay rent and bills, and also such as spending money, be able to use leisure time. So again, they've got a point here, but what they're missing, because this was another 7 out of 8, is in this last point. They just needed an extra sentence. This would allow her to maintain her independence. This would allow her to control her finances. This would allow her to live alone. So this one, you can see with every point, they've explained the support, and then it's tied to how that helps her to live independently, the context of the question being used. This last one, that last point, just needed one extra sentence to get the full 8. Second response, social care professionals such as a care worker might observe what Shirley can do independently, what she struggles to do independently. So they've talked about this, they could observe. For example, she's late to work. This means that she struggles to wake up, organise her day, so she leaves at a time that wouldn't be late. So they talk about support worker providing an alarm clock, which was on the mark scheme. So we'll kind of give that as a point. And it talks about having a whiteboard, having transport arrangements, support. And again, this would support her to live alone, but still have assistance with things she struggles to do independently. So that's probably where your second point, living alone. Another way that she could be supported to live alone is by having adaptations made to her house so that she can do tasks on her own, as well as having arranged food deliveries so she's eating a balanced diet. Again, the example gave this too. There are a couple of points that I think, obviously, there are areas that could be added in. So, you know, they talk about the meals, which could be linked. That was kind of suggested on the mark scheme. But I'm assuming it just needs a little bit more detail, a little bit more explanation, and more links to independence. So a few little tweaks that could be made, but there are some potentials here. Again, the system I use is make a point, explain the point, make sure you're answering the question. And then my key tips, the last things really, my final thoughts: learn the content and the organisations, practice as many questions as possible. Think about the services people need. So if you've got different patients, different illnesses, what services, what support would they need? Try and think about who they might get to help them. And the point I always make to my students, if you're ever unsure, add one more. So if you put 4 points down, you're not confident about one, stick a 5th in. You know, if you're not sure about a point, add one more to it, develop it further if you've got the time. Don't spend 40 minutes writing 1 8 marker. You know, make sure you spend the right amount of time. But again, my general rule, if you're ever unsure, do one more. So hopefully this gives you a little bit of guidance about 8 markers, just about how the questions come together effectively. Make a point, explain the point, connect to the case study, make sure you're using your words, your terminology, and if you can, put in some evaluation as you go. But take a look at those previous examples. They are examples from the exam board, a 7 and a 2. You can see the structures there for those questions. And again, practice them. Take a look at these questions, have a go, and get your teachers to take a look. As always, thanks for watching. Hope this has helped. And again, tell people about the channel, like, subscribe, all those great things. And I'll speak to you all soon.